Before we get started with today's episode, I do want to express that the views and opinions expressed in this program are those of the individuals themselves and do not reflect the views or thoughts of any particular organization. Lastly, I just want to make a couple announcements. So one, definitely sign up today at tinyurl.com/capsulrxservices if you need any help with your letter of intent and CVs. I know now is the time. So definitely, if you need help with that, reach out. We'll do the best that we can to help you. And same thing if you're struggling with the NAPLEX, all right? If you're having any issues preparing for the NAPLEX, definitely reach out. We also offer tutoring services for the NAPLEX. And last but not least, we just added the wealth consultation program. And so multiple people have been reaching out, kind of asking me, what am I doing to lower my taxable income? And also different things that I'm doing in regards to an LLC. How do you create one? How do you start a business? How do you file things correctly and whatnot? So if you need any assistance with that, feel free to reach out at tinyurl.com/capsulrxservices. And last but not least, with our special guest today, I definitely want y'all to go ahead and check out his Instagram, stay, STAY, fresh, FRESH 526. All right. He stay fresh 526. It's going to be an awesome episode. A lot of y'all have been interested in industry. And so we're really trying to break down that connection between industry and pharmacy and the importance of having that relationship. So definitely reach out to him if you have any questions, or reach out to me if you have any issues getting in contact with him. Thank you, guys. Hello, and welcome to another episode of Capsule RX Podcast. Today, I'll be your host, Dr. Jovan Lazo. And today I have a special guest, someone who I'm very flattered to have on the podcast. I can talk about the profession of pharmacy, not as a pharmacist, but in a different way, and how they provide so much value to pharmacy. So today I have somebody coming from a medical sales department, Manuel Wilson. How are you doing today?
Good. Thanks, Jovan. Thanks for having me. Happy and to be on your podcast. Honored that you gave me an opportunity to participate. So I'm looking forward to it.
Yeah, definitely. So to start off, can you kind of provide a brief introduction to our audience today about yourself?
Yeah, absolutely. Yeah, my name is Manuel Wilson. I'm a medical sales professional, and been in the industry for probably about a little over 15 years. I've served in a variety of different roles, variety of different disease states, and worked with local level, independent internal medicine physician. I've done cardiology, pulmonology, hospitals, and health systems. So I have a wide range.
Awesome. And so that's one of the reasons why I would definitely wanted to have you on here, because you have so much experience in different departments and dealing with different healthcare professionals. And this is kind of an often forgot about impact in the patient care aspect for a patient, right? It's not always just the people who meet the patient. It's also people working behind the scenes to help maybe get a medicine to a facility or to a pharmacy to be able to give to a patient. So now that you kind of just touched upon your background in medical sales, what would you say are some of the daily tasks that you have to do in this position? What's the day in a life?
Yeah, absolutely. Generally speaking, you'll get up, and it's all about, number one, do you have appointments, booked with a healthcare provider, healthcare professional or not, or an account or not, and that kind of dictates your day. So let's say hypothetically, let's say I have, appointments at different hospital X or hospital Y or Z. Then I'll go there, let's say pharmacy department, maybe I have in-service or lunch in-service, maybe something I'm doing, or I may have a dinner program where I'm getting customers out to have educational discussions regarding the medications that I represent. Or, and if I don't have appointments, a lot of times it may not be as glamorous when you're firing off emails, right? You're firing off emails with different, HCPs or pharmacists, whoever, trying to get appointments, to have important discussions regarding whatever medication you're representing or dealing with. So that's a key to following the schedule based upon, your appointments dictate your day based upon wherever the locations are, wherever those clinics are or hospitals. And if not, you're scheduling and trying to get appointments, but let's say you have a jam-packed day. For me, they look like, getting up early in the morning. I'm maybe seeing some clinics in an ambulatory setting, right? Seeing some providers there. I think I'm, in my current role, I don't carry samples like I used to, but, a pharmaceutical person rep or something like that could carry samples and have them, with them in their car and have a physician sign for them, and also provide an educational discussion during those times. If not, then, like I said, then you're meant to be at the hospital, and you're trying to get them to see the value of improving patient care with whatever disease state you're representing and having a conversation about it.
Okay. So it sounds like majority of your day, if you have appointments already set up, it's going to be probably like informal or formal presentations
Mhm.
and really just connecting, maybe not providing samples and different things like that. So a lot of communication, a lot of presentations, basically.
Yeah, absolutely. A lot of presentations. And it's all geared around, what the needs are and where a particular HCP physician or a pharmacist is in terms of what your goals are. Right? You have to have your goals first and foremost. So let's say you're talking to a pharmacist, in a particular hospital, maybe a pharmacy director or a clinical pharmacist on the inpatient side. We want to find out what their treatment goals are, whatever you think, they're currently managing, right? And the perspective, get to ask them questions, open-ended questions to kind of understand a little deeper about how they view your medication, how they view the disease, as a whole, and how you want to also do presentations in terms of presenting the clinical differences between your medication and other medications, or how it fits the overall goal of improving patient health,
Hmm.
for the system or just at large, right? Because overall, the goal is to help patients improve their quality of life. You want to help both the organization or whatever you represent as medications that are doing that bit by bit, right? Just with
Yeah.
efficacy, safety data. And then overall now self-care is kind of, a lot of conglomerates are being purchased, things of that nature. You're getting smaller and smaller in terms of number of large institutions and systems that are existing, right? Large institutions are beginning to purchase, other, smaller practices
Smaller.
that were private
Yeah.
practices. And so now keeping a standardized of care, how do we provide the best quality of care and standardize it across the continuum for whatever respective disease state?
Okay. Definitely. And I could see that with more and more, especially after COVID, a lot of
Mhm.
businesses losing money, and that also impacts the pharmacy profession. Some of the smaller hospitals get bought out by larger corporations, and then they're trying to standardize their formulary lists across all aspects of their regions and whatnot. So that definitely makes
Absolutely.
okay. And when it comes to those days where you're not doing the presentations and the meetings, you're saying it's really a lot of trying to get in contact with people, emailing. I'm assuming also probably preparing for presentations.
Absolutely. Absolutely.
Okay.
You want to stay sharp. So, you're definitely reviewing your sales data you have, information, so all the different presentations, making sure you know the ins and outs. You're always constantly learning. It's always a dynamic process. So there's always something to learn, and make sure you're sharp and, on top of your game in terms of when you get in front of those healthcare providers, because last thing you want to do is call, be completely unprepared. It's okay not to know everything,
Yeah.
and say, hey, listen, I don't know. I'll get back to you. But so a lot of times preparing for that. And then in addition to that, sometimes you just maybe cold calling, right? Sometimes, you're exploring, you're trying to find out who's who, right? You're trying to, you're almost like a detective, as I call it, kind of like trying to put the
Mhm.
pieces of the puzzle together to
Okay.
have a greater understanding of who's in charge of whatever department, who's in charge of this initiative, who's in charge of that initiative. And a lot of times, especially when you're dealing with a large system, you may not know the answers to that, or a large group or what you're representing. And so it's a lot of fact finding, a lot of just getting out there, boots on the ground and asking questions and maybe driving here, driving there. So that is probably the one of the most exciting but challenging, parts of the job. But that's kind of how it goes, right?
Okay. Yeah, definitely. Like we all have aspects of the job that are a little bit more challenging or a little bit more cumbersome than others. It's just the way it is.
Yeah,
You're not gonna love
absolutely.
every single thing you do within the job. There's always gonna be
Right.
something that might be
Absolutely.
a little bit annoying or might not be the thing you enjoy the most to do, but you still got to do it to get the job done. Gotcha.
Absolutely. Yep.
So knowing you and kind of hearing what you're talking about, one of the things I always like to know when it comes to a job is like what are the types of people, the personality traits that excel at this job. And it's not only me, it's basically every company because they all make you do a personality test to see
Right.
how you fit within the team dynamics and see how you would fit as an
Mhm.
employee within that company. So, what would
Exactly.
you say you've kind of noticed were like 3 to 5 personality traits that you need to be successful in this role in medical sales?
Absolutely. So you brought up a really good point. I mean, in the past, I think a lot of companies or organizations were simply looking at the resume only, right? And all,
Hmm.
what are your sales numbers? Did you have a good year? Did you have a bad year? But I think a lot of Harvard reviews and Yale scholars have really kind of dug a little deeper in this, and they're really looking at what they found out is a lot of the intangible qualities, right? Some of those not so easy to measure qualities are really what makes it successful person in sales and in a lot of these roles. And so for me, I think what makes it somebody successful, number one, being really passionate about what you do, right? And really believing in that, right? So for me, it's really hard for me to represent a brand or a medication or even a perspective, right? Anything, right? Without actually really being passionate and believing it. So I have to really get deep down into the science, really understand the MOA, the clinical differences, the benefits for the patient, how it impacts a patient's life and how it helps, right? Whatever way, shape, or form. And so these are key things I think about. So you got to be passionate, number one. If you're passionate about that, then obviously you have belief, you have confidence that you're going to give off a trait, which is, really makes a huge difference. Because,
Yes.
who wants somebody to come into them who doesn't seem like they really believe in what they're talking about? If you lack confidence, then why should I believe in anything you're saying? How can my patients have confidence that this treatment, whatever option it is going to be beneficial for them? So I definitely say the passion, confidence, self-belief, and being strategic, right? Being very strategic in the way you do things. So there's a lot of twists and turns in terms of as a rep when you're trying, or self-professional, when you're trying to accomplish different goals and objectives. So you have to kind of also be strategic and have a plan in place, right? Sit down. So sometimes, honestly, the best, times for me are just sitting down, taking a break from work and, maybe on a lunch break, or sometimes even the evening when I'm taking some time to myself and just thinking like, okay, what can I do differently? How can I be innovative? How can I, find a new way to approach my business to take things to another level to really impact healthcare with whatever my assigned geography or responsibilities are. And that's not easy, right? It's just thinking outside the box. I think some of my greatest successes that I've had and accomplished in my career has been with me just literally in the evening in my free time, relaxing at home, just trying to think outside the box. And so I think that's really important. And then, one of the hot words now, I think is popular word is grit, right? Grit is the big word everybody's using now. I still use the old school words, perseverance, right? Persevering through obstacles, trials, tribulations. So you're going to get a lot of no's. You're going to get a lot of no's, a lot of doors shut in your face, like get out of here. People are annoyed, because they have a perception of you. As a medical sales professional, it's oftentimes perception is reality. And so you really have to have a mindset where I'm not going to give up. I'm not going to stop. I'm not going to let this deter me. That, when there's a will, there's a way. So no matter what comes, in my way, maybe people are saying like, we're not going to, write your medication. We don't believe in this. We don't believe in that. There's just a lot of resistance. You have to have the mental fortitude to push through, keep fighting, keep going. And so I think that grit and that perseverance is the key to you really being successful as well.
Yeah. I'm a big fan of the word. Shout out to Angela Duckworth. Don't know you,
yes,
but
yeah.
Shout out to her and her TED Talk.
Yes.
Definitely mentioning this word. And that's kind of where it all came from, right? But
absolutely,
definitely see grit, definitely see how hard you work, and it talks with you. And that made me even think about another question, kind of tying into the daily task. You don't really have, it's not really like a 9 to 5 type of position, right? It's more like, is it more you get your hours in whenever? Like, is it like a scheduled amount of time each day you're supposed to work, or how does that work?
There's an official schedule.
Okay.
Of 8:30 or 9 to 5 for most companies. So you have that time frame you work within, but how you utilize that time is it can be subjective at times, right?
Okay.
And so it's once again, it's all about the company. It's all about what metrics and things they have in place, their requirements. But as you move up the hierarchy in terms of your sales roles, you usually get a little bit more autonomy where you're still gonna have some metrics you have to meet, whether it's seeing a certain amount of customers, a certain amount of times, reach your frequency, they call it. But, there's usually, the higher you go, usually they allow more time for you to really have, meetings with your internal teammates, internal stakeholders, and have this, real strategic discussions, right? You may have a team environment where you have team members you may collaborate with, to achieve certain goals and objectives. And so that strategy part is so key because what I've always kind of done it when I was by myself working as an individual rep with no partners, but it's just so critical and key to your success as well, because if you don't have a plan, you don't have a plan, you plan to fail, right? And so just, there's a lot of representatives and people in the profession that may just aimlessly, they're busy, right? They're busy about it. They're going here, they're going there. And it's like, oh, I'm just so busy today. Okay. You want to be busy, but you want to be effective, right? Yeah. So, working smarter, not harder, is a good phrase, a lot of successful medical sales professionals use. And that's how you take things to another level, not just wasting your time driving all over the place, and whatever you accomplish. So you have to be really intentional on what you do and the way you do.
Got it. Yeah. And that's probably anything dealing with sales. There's going to be a lot of driving, a lot of going around, and you want to make sure that your time is not being wasted and you're providing value to the company. So
Exactly.
definitely appreciate you mentioning that.
Absolutely.
So, how would you say medical sales really plays a role in the patient
Mhm.
healthcare process? Because that's, like I said earlier, that's just the one thing I think nobody really thinks about. Everybody thinks about the doctor, the
Right.
pharmacist, the nurse, you know, the more hands-on patient care aspect, but there's other processes too, right? It's how do we get this drug to a formulary? How do we get this drug to this hospital to give it to this patient? How do we get it to the community to have it continue going on outpatient? Is it affordable? All those different things kind of play a part in the healthcare process that often gets forgotten about. So I was just kind of wondering, how does medical sales really impact the patient healthcare?
Right. Great question. So in a number of different ways. So I guess one of the key ways that comes to my mind is just education, right? So a lot of times people will see doctors and they've been to medical school and even pharmacists as well. They're very intelligent, very sharp, and they have a large amount of data, information, or science that they've mastered, and they expertise in terms of even practicing, application wise and certain things like that. But there's so much room for growth. There's always people are always learning, right? And conditions are no different there. Like I said, I tell everybody all this time when I talk about they get so worried about certain specialists. It's like I still personally, everybody haven't met anybody from Jupiter, Mars, or Pluto. They're all human, and
Yes.
so from that standpoint, there's always going to be gaps in information. And so they're running around, let's say certain specialists are doing procedures and doing this and doing that, unless their boards are coming up, unless certain, things subscribe to certain education updates, clinical updates, they may miss information. And so that's where we come in. So a lot of times you'd be surprised at how many physicians, how many, you know, medical professionals at large don't know certain key information that are clinical updates in whatever respective disease state you're dealing with. And so these clinical updates have been peer reviewed, they've been studied by researchers, scientists, and they tested. And they're all geared at improving patient health and healthcare, and also reducing costs. So
Mm.
key aspects of a lot of systemic systems used nowadays is quadruple aim. How can you improve population health? How can you reduce cost of care? How can you enhance the patient care? Things of that nature. So providing that information that they may not have time to get or they may not be aware of, then it's like a domino effect. So once they have educational information and they understand how science, medication, or, the healthcare profession may have changed in certain key areas where whatever disease state they're practicing in, helps them to be informed, helps them to be sharp, and then they therefore pack the information on the patient. And then when the patient gets improved, care as a result of the physician being more knowledgeable and up to date. And so a lot of times if they're not up to date or a pharmacist whoever is not up to date, then, there's a gap and there's a missed opportunity. But maybe a medication or treatment was great for a patient 5, 6 years ago, but there's been new clinical updates that happen all the time. And so doctors or anybody could be practicing, medicine from, you know, 10 years ago. And if
Yeah.
they not read up to date and they don't have the information, they don't have time, they're very busy and missing opportunities to improve patient care. So yes, a patient may be doing good, but I always ask the clinician, number ones, can they be doing better? If it was your parent, it was your family member, your relative, they're doing good, but would you want your family member or loved one to be doing better? And that's always what I think from a medical profession and healthcare profession. We should always be trying to do better and do what's best. Told. And so I think that's the education piece and informing them and sharing those things with them, is one way that it really improves, patient care for the patients. Another way I think too, a lot of additional organizations or medical organizations, well, pharmaceutical in this case, are becoming more and more streamlined in terms of how they provide information or resources to provide this healthcare profession. So a lot of times that may be copay cards or maybe patient assistance programs to help them get access to the medication, access to the key component of this, right? Can they afford it? And so now we're always striving to, the pharmaceutical organizations to make sure patients can afford the medication and have resources and tools help them afford and get access to it, because it doesn't no good to have the best medication in the world, but they can't afford it. And so that's another key way it impacts patient care. And then also just, we have resources for systems, different hospitals and different systems to improve the way they do things or help them support. Sometimes, there's a workload, right? You have logistics and what nature. So do they have enough staff or employees or,
Mhm.
pharmacists, whoever, to carry out certain responsibilities, right? And if they don't, there's a gap oftentimes in terms of the overall personnel. What can we do and how can we help you streamline the way you view patient care? How can we help, make it so it's not such a heavy lift for you? And maybe being a little bit more strategic, a little more intentional and help you develop processes and things of that nature that are going to be supportive for the patient and make it a lot more efficient.
Got it. Okay. So it's really going to be the exposure to information is one key thing. And that's why I even have this podcast is because if you don't know
Mhm.
about different career paths in pharmacy and different things that are impacting healthcare, how are you going to know that you can do it? How do you
Right.
know if you can fix it? How do you know if you can resolve an issue? So really bringing that exposure, if there's any clinical updates, new guidelines that support something, providing that evidence, educating these providers and these healthcare professionals on that information, and then also being sure to optimize not only how maybe what they're recommending, educate them so they can maybe optimize what they're recommending, but also optimize the process of the entire maybe if there's issues with patients receiving the medication outpatient, like
Yeah.
helping with that aspect or optimizing maybe like a order set for a hospital or something like that. So that's
Absolutely.
something I didn't even know you all do. So it's like
Yes.
it's interesting to know because like if I don't ask, I won't know. And if I don't know,
Right.
I definitely know my listeners don't know. So
Exactly.
I'm glad you're
Absolutely.
able to share that
Yes.
because I didn't realize
Absolutely.
they had that much that they also assisted in that way. The medical sales department also assisted in that way. So that's very interesting to know.
Absolutely. Yeah, definitely. Trying to find additional ways that provide be more of a value add, right? We're not just
Mhm.
here to, as they used to always say, show up and throw up, just show up and throw up information. And
Yeah.
hey, that's kind of the new wave of healthcare from a pharmaceutical perspective.
Yeah. I like that. So the new wave is it's kind of gone away from just being able to I don't want to sound like disrespectful to your profession, but like
No, no,
pushing a medication. It's gone
absolutely.
more to providing education and also improving the process of receiving the medication. So it
Absolutely.
went from
Absolutely.
just pushing to improving the process and exposure. And that's just how it is with time. Like everybody's
Mhm.
adjusting to new things. The pharmacist position isn't the same as it once was. We're starting to get
Mhm.
prescribing rights.
Yeah,
So we can start ordering medications in certain states and even
absolutely.
certain things in here in Florida, like with Paxlovid, we can go ahead and give. So it's certain
Mhm.
things that you're starting to see changes, and that just happens with time. And so that's one of the changes that's been happening, I guess, with your profession. So that's great to know.
Absolutely. Yeah, absolutely. For sure.
Okay. And so one of the things I know I had a colleague who was in my class. I think he ended up becoming part of a medical sales position to try to get into the industry route instead of probably doing the fellowship. So that made me think of this question. What position do you believe in pharmacy is kind of similar to what you do, if there is one?
Right. Speaking specifically in terms of pharmacists, how they may be integrated in terms of like the pharmaceutical world, in terms
Hmm.
of from an employment perspective. Usually everybody has a different name for them, but the general term that most companies use is MSL, medical science liaison.
Okay.
And so usually you know, they're just more on the clinical side. So they provide high level, deep level research, scientific information that they can protect, right? They can on label, off label information,
Mhm.
and are usually a supportive resource to provide, that extra value to physician and healthcare providers that otherwise may not be as receptive to hearing information from somebody who's not credentialed, right?
Yeah.
And so that's kind of one of the key roles that most people are familiar with. And then there's also, we have what they're expanded into is general educator roles now. There's other roles called educators. And everybody's name is different. Some of them are just clinical educators. And that could be a pharmacist,
Mm. Yeah.
things
I've
like that.
seen I've seen not to cut you off, but I've seen
Oh,
like a
sure.
diabetes educator for some pharmaceutical companies. So it's like something like
Mhm.
that you're saying?
Absolutely. Yeah. There's such
Okay.
a, honestly, just to answer the question, there's really no limit to what,
Got
how pharmaceutical companies now are utilizing services and the benefits that pharmacists provide. As we just stated earlier, the role of pharmacists has evolved over time within healthcare settings, things of that nature. It's evolving with the pharmaceutical companies. And so one thing I'll say is that you're highly respected, highly valued, and they're finding innovative ways to utilize your services, the talents and gifts that you guys provide in a number of ways. Some are educators. There's even different roles in certain companies where that same pharmacist may be able to work closely with more sales organization teams. Usually they're MSLs usually more siloed for the most part, but there's also ways that they're kind of getting in the action, so to speak. They're part of a larger team that has a commercial sales component to it. And they're used as a thought leader, in the perspective of providing clinical information, but also being part of strategy to move business forward. But that clinical background piece, and then you mesh it with the pharmaceutical sales experience, those two is just, it's a powerful, combination. And it's just really important. I have teammates that, I work with all the time in a team environment that are a pharmacist, and there's nothing more powerful than be able to have them with us for customer appointments, customer conversations, providing different level of insight based upon their expertise and their background, but also learning from us too, right? How we can do things. For me, I have a business background, undergrad in business, and graduate in sales and marketing. So, we learn from each other, iron sharpens iron, right? And so that provides a unique perspective to them that's probably helpful for them in terms of seeing the bigger picture from a different lens. And so wide variety of opportunities. And then you can think of education is going to be the key thing. Once again, I know I'm kind of wearing that word out, but that's kind of what, pharmacists are doing in a pharmaceutical capacity. Some are even on research teams too, scientific research, if that's their thing. They're interested in that, Okay. So consultants, there's as high as you want to go, or it's just, more, even kill you want to be, there's a number of different opportunities.
Okay, no, thank you for that. I always wondered what those like educator roles were like compared to MSL or different things, but it's probably just different verbiage per company. It's all relatively similar.
Yeah, relatively similar. Yeah. And the question is, some are more siloed in nature where, there's no interaction with sales, the commercial component. And then some are happy to have a little straddle line to be a little bit of balance. So they're able to be in science side, but also participate in some of the strategic business sales conversations as well.
Got it. Okay. Yeah. All right. Perfect. Thank you for that.
Absolutely.
So one of the things I also wanted to ask you was, how important do you believe it is for pharmacists to have a relationship with people from a medical sales department? Just because that's not something that's ever talked about. They don't tell you that in pharmacy school.
Yeah. Okay.
They don't teach it. You're not thinking of anything of it besides a dinner.
Right. Exactly.
So
Yeah.
it's like, you don't really hear things about this. So to me, I see the value. I understood it right away. But I don't believe the average student or the average pharmacist does. And so I wanted to kind of see if you could shed the light on why it's so important and valuable for pharmacists to have a relationship with somebody from a medical sales department.
Right. Absolutely. So some of the things we kind of touched on a little bit earlier, but definitely it's important for once again, the flow of information, right? So pharmacists, I will say, easily a little bit more up to date on all kind of clinical medications, treatments, and updates. But once again, nobody's perfect. There may be situations and medications and guideline updates regarding whatever disease state, or updates regarding whatever medication, new indications, new treatment options that are available to help patients. And once again, if you miss that opportunity, you don't know what you don't know, right? And so being able to engage with a medical sales professional that can share with you updates, you don't always have to go do all the work yourself. We're here. It's part of our actual job, just provide information and share information with you. So understanding new safety information, new efficacy information regarding whatever respective medication, we provide that to you. So, you don't have to go searching for it. We have a number of different resources you can get to, not only for yourself, number one, but also for patients, right? And so a lot of times, depending upon whatever initiatives or project you guys are working on, or whatever your focus is within the health system or hospital, having that information that you can share with the patients and be a value add to them, right? Patients are using you guys a lot of times as a conduit to help them understand, deeper level information regarding their treatment options, right? And how is it helping me? How do I, what's my, even psychology of how should I feel about, let's say, whatever disease I've got now, you know what I mean? So
yeah,
how does that impact them? So that's one of the things in terms of information and resources that we can provide. Back to the same thing again, we talked about earlier, strategy, right? So pharmacists within the hospital or health system, or even healthcare in general, a lot of times you guys get projects, you get responsibilities, things you have to pull through, right? And so you don't always, once again, we may help you do your job in certain way, shape, or form. You never know, all the way. So let's say you have a certain initiative with the transition of care you have to do or whatever. We may have resources, that unbranded or whatever, that may be able to support you in terms of some of the initiatives or projects you're working on. We may have worked with another hospital in a different state, in a different city or whatever, that's done, that has a best practice, right? That's able to help you implement something like that you're working on, whatever project it is. I'm getting very general based. I don't know which projects or whatever, but whatever process you're trying to get done or whatever your project is, we work with a lot of different, clinics, physician offices, hospitals that may have had some best practices and been able to find ways to efficiently do whatever you're trying to do. And so we can share these best practices with you if you're engaging with us and you have a relationship with us, right? We can provide that information and make your choices. Sometimes you don't always have to reinvent the wheel.
Yeah.
But without that conversation, without that relationship, there's so much information that you miss out on and opportunities to not only make your life easier as a pharmacist, but to impact the patient care. And honestly, a lot of pharmacists, sometimes you're fresh out of school, you're young, you're trying to make a name for yourself. A lot of them have ambitions, right? You want to move up the company hierarchy. So you, believe it or not, pharmaceutical reps and representatives and medical companies can be a huge resource to helping you achieve all your goals because it's a mutually beneficial relationship. We're all trying to find ways to help improve patient care in whatever respective disease state or area we're focused on. And we all have different resources we can provide you and you can provide us information as well to help patients overall. And so it can make your life easier in a lot of different ways and really be beneficial from a clinical perspective.
Yeah, definitely. I didn't even think about that on like that last little bit that you just mentioned. I didn't really think about how it could impact the pharmacist too when it comes to improving their career aspirations. But I definitely can see that. And another thing too, I wanted to mention that from my experience, I believe is also beneficial is the patient access. The education that's so vital and being able to optimize care, make everything great, but also helping things become accessible for the patient, whether it's like you mentioned earlier, maybe it's samples you're able to provide to a clinic, to hold over a patient until this pharmacy gets the medication, right? That could be very crucial depending on the medication. So really creating ways for things to be affordable. Maybe it's coupons.
Yes.
Copay cards, different things like that. So making things really accessible for a patient because we all know what's best for a patient. And sometimes what's best is new and what's new can be expensive.
Right.
But
exactly.
that doesn't mean they can't get it. There might be some copay cards. There might be some samples, different things like that. I know this has happened to me multiple times. Maybe somebody just switched insurances and it hasn't kicked in yet. And so it's like, well, what do we do? Do we do nothing or can we at least provide samples in the meantime? So having a doctor who has those samples in their clinic to hold them over until the new insurance kicks in, and then they can go get that medication to be filled. And now they're good. Now there's no problem. So that's another thing I just wanted to mention real quick that I personally have noticed from the medical sales team. And so I'm very thankful for you guys to always make sure patients are able to have access to their meds.
Yeah. A lot of each company has their own patient support programs that are all geared towards financial access. And so I want to say one thing about that real quick, because there must get perception of reality a lot of times. A lot of times there's a perception. Don't get me wrong. There's no some medications can be very expensive. It's all relative.
Yeah.
But a lot of times the perception is that we as medical sales reps and professionals and organizations want to make medications as expensive as possible to make more money. And it's not the case. I mean, don't get me wrong. There's certain treatment options that are highly expensive, but honestly, number one, we do it from a patient perspective. We want to make our medications more because honestly, you want more patients to take it, and that's just your business and volume, right? So if you have a really expensive medication or no, financial support, and you get like 5 patients to take it versus 500 patients, you know what I mean? It's a sheer volume play. I say that to say that we are investing 100% in this industry in terms of really making sure that we support patients from a financial perspective. It does the company no good. It does the sales representative no good to have a medication that the patients can't afford. It's one of the worst things in our world, we can deal with. Like hearing the patient can't afford it, like, oh no, okay, how can we help? That's the first thing we go to our mind. How can we help them afford it? What resources can we provide?
Yeah, I completely agree. And sometimes it's hard to break that down to people.
Yeah.
Especially even as a pharmacist, because they think you're in on it.
Right.
But whether it's family members, friends, or some of your patients. But to me, I just think it mathematically makes sense for something to be affordable because if it's affordable, then the sheer value would bring more money than something being highly expensive and you just can't afford it.
Right. Absolutely.
That's just my opinion, but I don't know. I don't own any big businesses, so I can't comment on that.
Exactly.
But that's just what I would think, but I understand why people feel that way.
Yeah, absolutely. Absolutely.
Definitely. All right. So what would you say is kind of like the blueprint to get into medical sales. So if anybody's listening, this is something that they're interested in. What would you say? What would be your recommendations for them to do, especially now in 2023 where things have
Mhm.
changed so much?
Absolutely. Yeah. So it's always been, a tough thing, enigma, like, how do I get into the medical sales from experience, even for, people with my background. But I would say in the business, interpersonal skills, right? Being able to have conversations, being open to dialogue and networking, right? So one of the key ways I'd say is, once again, pharmaceutical representatives, pharmaceutical managers you run into, talk to them, ask them about their company, ask them about opportunities, ask them for the business part, send them an email, you know what I mean? And start to build and cultivate that relationship with them. And they're more than happy, trust me, to really help you understand a little bit more about what opportunities each company offers. And they're looking for a way. Most companies, I can't think of any companies not always looking for a credentialed pharmacist to get into the industry, to get into their company and to be providing value. So that's probably one of the easiest ways first. I said, just because just to let everyone know, you're highly respected as a pharmacist. Trust me. Within our industry, you're respected as a value add. And we're just excited about any opportunity to have you on board with whatever company we work for. So that would be the first thing. Outside of that, in terms of getting into the industry, I mean, honestly, I think that's pretty much one of the main things. And once again, if you go to dinner programs, if you go to these things, just ask them questions. Ask them, your
Mhm.
local medical sales rep that you have in whatever area. I think, of course, applying, creating, the same thing everybody else says, right? Create an
Yeah.
account on the employer's website. But the main thing is really building that interpersonal connection with the local person that you deal with. I think that's probably the best way.
Okay. It's just one of those where the network matters.
Yeah, network is absolutely for sure.
Gotcha.
Always.
Okay. And so this for my last question to kind of wrap things up, what would you say is one message that you would like our audience to walk away with today?
Yeah, so I would just say, understand that there's a lot of information out there regarding medical sales reps, pharmaceutical insurance, and stuff like that. But understand that, hey, listen, really, we are not the big bad wolf. We're here to support you. We're here to partner
Yeah.
with you. We're here to work with you. And don't get me wrong, like everything else, you got bad apples and everything. But understand that's the whole, right? That represents the whole the perspective regarding medical sales in the industry.
Mhm.
There's a lot of good people out there. I've seen many companies, our friends working at all kinds of companies and with organizations. You're doing it a lot longer than I have. And they really do care about the patients. You know what I mean? That's kind of why we got our engineers. I didn't have a science background. I was a business guy, sales and marketing, and I didn't know anything about the medical profession. But once I got the information, I got the literature, I started reading, I started understanding. I enjoyed it. I found it passionate. I was like, this is really good. I have opportunity to do something that's providing a higher level of value to humanity, to the world at large, the medical field, by providing people information that they do not have and letting them understand these are the different options you have, and you make your choice, of course. And so for me, I understand we are here to help you, support you, and would love to build a relationship with you. And hey, you're valued. As pharmacists, you're valued, you're important. We understand in the industry, you're not just counting pills. We understand that. You're so much more than
Thank
that,
you.
right? Yes. Trust me, we get it. You know what I mean? We are well ahead of the curve regarding that and understanding that. So we want you on our team. We want to partner with you. We want to work with you in whatever capacity we can. And hey, thank you guys. We appreciate you, all your hard work and all your service.
And we thank you all as well. It goes hand in hand to helping bring the best patient care experience possible for the patients, because that's ultimately our goal. That's ultimately your goal. When we work together, we're able to make it happen. So without us, there is no you. It's just a fact.
Absolutely.
We need each other to make these things happen. So thank you so much for coming on. I greatly appreciate it. This is something that a lot of people don't know about. Medical sales is so different. They probably don't know what goes into the day-to-days and what's really this profession is about. Like I said earlier, you kind of touched upon it, perception. The perception is probably just trying to sell a drug, but the times have changed where it's really providing that extra information, that education, updating maybe people on guidelines and updating people on maybe a new indication for a medication, and then also transitioning to how can we optimize the process for this healthcare system to help improve the patient care. So thank you so much for coming on. I greatly appreciate it. Uh,
Absolutely. It's a pleasure.
yeah, greatly appreciate it. So it's been awesome to have you. And before I let you go, is there any questions you have for me?
No, not at this time,
All right.
but I think you're doing a great job with the podcast. I think it's
Thank you.
wonderful. I'm providing this information and a resource to pharmacists and just people in the healthcare community as a whole. So definitely keep it up. I enjoyed it, and I recommend anybody else to see this. Hey, listen, look for an opportunity to provide your voice and share your voice with Joven and make a difference for sure.
I appreciate that. Thank you so much, man.
No problem. Absolutely.
Did you learn something valuable from this episode? Then I highly recommend you like, comment, follow, and subscribe to our new YouTube channel at new_capsule_RX podcast. And we're also on Instagram and TikTok with the same name at new_capsule_RX podcast on all platforms.